So good morning, everyone. Before we actually get into our two Grand Rounds talks this morning, we have two very special guests, Dr. Tom Grono and Dr. Gene Kuttner. All of you know Tom is a CEO, as well as other positions at the University of Colorado Hospital. Gene Kuttner holds two C titles, right? Chief Medical Officer and Chief Academic Officer. And they're here to help celebrate National Doctors Day, which was March 30th. And they're doing a world tour of the various Grand Rounds. And they also bought us breakfast this morning. So a round of applause as they come up and give you a few short words.
Good morning. Happy National Doctors Day, a week late. Tom and I are really thrilled to be able to be here in person. You know, we've tried various things over the years and how to recognize and thank you for all that you do, your commitment to patient care, your commitment to education and to advancing knowledge. And we found this coming in person to be able to actually see you face to face, buy you a little breakfast is actually, maybe it's more gratifying for us than for you, but we really are entirely grateful to all of you. You know, we couldn't do anything that we do here without all of you. And just really want to thank you and let you know that we are here for you, and our jobs are to support you so that you can do what you do every day to provide excellent patient care.
Thanks, Jean. Good morning, everyone. On behalf of our whole senior leadership team, I do want to say thank you for all that you do. I think a couple of things to highlight since we were up here a year ago on this stage, and to show you how much change and positive improvement we can make in a one-year period. Our mortality is significantly reduced, largely because of a lot of efforts that have impacted our observed mortality, not just our expected mortality. And we're doing that work, but it takes you all and your commitment to make that happen. That's work from GIP Hospice, which I will be on stage in front of the public to admit this was Rich Schulich's idea to introduce GIP Hospice into our facility, and we've had really good outcomes from that. Work on deterioration has been also the big factor in us catching deterioration earlier on patients and intervening before it's too late. And all of this implies that we are more reliable, that we have better outcomes, and that patients that choose us for care have a better chance of not just surviving, but having a high quality of life and returning to the extraordinary things that they do each and every day. All of that is possible because of you, and I want to say thank you for that. We have a new dean. We have, I think, a renewed and strengthened relationship between the school and the hospital that continues, our continued relationship with the Department of Surgery, and things that really happen that are important from an individual perspective, which you're going to hear a lot about today from a Grand Rounds standpoint of how we take care of ourselves, how we take care of our teams, and how we work together to continue to do great things for our patients. So thank you so much for your continued leadership and your work, and for taking great care of our collective patients. We could not do this without you. And thank you for the gesture and ability for us to come here to say a few words and also enjoy a breakfast. Rich said I've reduced your budget by 5%, so that's a positive thing. I'd also like to call out a couple of individuals, Dr. Higgins, Dr. Abood, as our previous administrative fellows and current administrative fellows that had the torturous time of spending a year with me and our team to learn about the intricacies of that. And then I see a rogue resident in the back, Andrew Mariotti, who is an anesthesia resident who apparently is here for free breakfast or on rotation with you all, one of the two, who also was an administrative fellow. But it's good to see familiar faces and to continue to invest in our future leaders on this campus. We're glad to have you here today too.
Thank you, Tom. Appreciate it. Thank you. Thank you. Thank you. Right. So our first, you can see a theme that we have this morning, and it's on wellness and longevity. You know, I have to say this is one of the periods in my career that I've been most stressed because of all the things going on, you know, at the government level, national government level, local government level, some really bad things that have happened to members of our department, and the stress of the funding environment and all the continued pressures that are put on us to get more and more done. But I think it's really important, as we absorb all this, and that's what we do as a surgical department. We just kind of put our heads down and take care of the business and take care of the patients and do the right thing. But I think it's really important to become more mindful and look for ways in how we can help ourselves and help each other. And that's really the crux of the two topics this morning. The first will be by Jeffrey Huber, who is an all-star physician's assistant in the GITE service. I'll give you just a very brief introduction of his education and his career path. He did his undergraduate and PA training at Santa Monica College, as well as the University of Southern California. He's worked for multiple health systems, including Exempla and Centura, before coming to us. The other interesting thing that I picked out from his CV is he was medical staff and director for several bicycle tours, right? Looks like the Amgen Tour of California for a couple of years. And then also now, more recently, the Colorado Classic. So he is really a great example of our allied partners in the Department of Surgery. And, we would not be as good as we are. We would not survive as a department without people like Jeff. And, we really look forward to your talk this morning on mindful moments. Thank you, Jeff.
Can you hear me okay? All right, get that one there. Perfect, thank you. Yeah, thank you for that introduction. I appreciate it. Thank you for this opportunity. Thank you to the Department of Surgery and to the Wellbeing Committee for allowing me to do this talk. This is a very near and dear to me, the mindful moments. In fact, before this, I was so excited about this talk. I was also pretty nervous, a little anxious, a little fearful. So I took a mindful moment. I found my breath. I took some deep breaths in, deep breaths out. And that's what I'm going to talk about here. So unlocking the benefits of mindfulness and cultivating presence and awareness. Some of the objectives are to discuss mental health in the medical field, develop ways to improve emotional regulation, focus, and concentration, explore stress reduction methods such as meditation, environmental meditation, and mindful breathing. Within the medical field, specifically for our providers, some of the mental health challenges include high rates of suicide, depression, anxiety, substance abuse, burnout, and compassion fatigue. A lot of these are unrecognized, misunderstood, and people are reluctant to seek out help because it's a sign of weakness, but it's not. Ask for help. Seeking help is not a sign of weakness. Early intervention is key. Confidential resources are available. Look on the CU portal under the Benefits and Wellness, the Wellness tab. There are multiple programs that are listed for mental health resources. Also, don't forget about the faculty and staff mental health clinic at the Health Science Building. Just so you know, mindfulness, what I'm about to talk about, is not a replacement for professional help. If there are challenges, seek mental health treatment, seek professional guidance. This mindfulness practice can be a nice adjunct to professional guidance. So what is mindfulness? It's basically taking a moment to focus on the present time, observing your thoughts, your feelings without judgment. This can be practiced anytime, anywhere, professionally, personally. It's shown to reduce stress, anxiety, and depression. If Here are a couple of techniques that I'll talk about a little bit more in depth. Mindful breathing, body scan, mindful observation, mindful eating and drinking, as well as walking meditation. To me, mindfulness is like hitting a pause button. Life is unpredictable, highs and lows. It's like a roller coaster. So the stress, anxiety, fears as we're on this roller coaster, and we're going through the loops and the turns, and then we're coming to the end, and we're excited to get off at that station, but it goes right on through that station. And you just keep going through this roller coaster on, and that stress, anxiety, fear builds and builds and builds and can be, paralyzing. So this mindfulness or this mindful moment is an opportunity to actually hit the pause button, be able to get off that roller coaster, ground yourself, find your breath, and then get back on that roller coaster with a little bit more clarity, a little bit more calm. So mindfulness, meditation, mindful moments has faced some skepticism for years and years and years, and it still does. There's concerns with efficiency, safety, cultural perceptions. So I just was kind of surfing around and I found some catchphrases that I wanted to throw up here. Voodoo, hippy dippy, it will never last, and keyhole. Well, not to trick you too much, but this is what actually was described about laparoscopic surgery. Implying that it was unscientific or based on dubious practices, suggesting non-traditional or overly simplistic approach, doubt about the sustainability or viable surgical option, dismissive or implying that it lacked a serious open surgery. So give it a chance, right? It seems like laparoscopic surgery stuck around for a little bit. So let's talk about mindfulness. Let's talk about maybe doing a moment. Some statistics about mindfulness in the workplace. 30% of adults have tried mindfulness or a meditation practice. 76% reported reduced stress levels. 67% reported better sleep. 58% less anxiety. Mindfulness is shown to decrease depression by 44%. And 58% of physicians believe mindfulness improves patient care. These are from NIH, Harvard, Stanford, and University of Massachusetts. Mindfulness and these mindful moments have been used in various settings, whether it be workplace, schools, or here in healthcare systems. Again, some of the benefits of mindfulness shown that it benefits our bodies and boosts our immune systems, increases emotional positivity, reduces negative emotions and stress, and improves focus and concentration. I think about it like how many times in our life has someone told you, cheer up, be happy, right? Maybe that might have helped, but a lot of times maybe you might have been a little irritated by this, right? It's because our emotions aren't just a light switch to flip on and off. Just by trying to be happy or trying to be calm or peaceful, that doesn't help. And also chasing those things that we think might make us happy or peaceful don't always work as well. Mindfulness isn't that switch. It won't just switch off our emotions or switch them back on. But a little bit of practice, trying to do some mindful moments, you can transfer or transform some of those difficult feelings, some of those challenges, and learn how to have a healthier relationship with some of those negative emotions. So personal life and professional life are interconnected. All are interwoven, both impact each other. Personal life impacts professional life impacts personal life. I didn't want to just throw definitions and statistics and techniques at you. I wanted to try to bring in some of the human element. So I would be remiss to not tell you a little bit about my personal life. So here's my beautiful family. Next to me is my son, Griffin. He was 15 at the time of this photo. He's now 20 in college up in Bozeman. My wife, Tina, and next to Tina is my son, my younger son, Brody. Brody was about 13 at the time of this photo. And shortly after that photo, Brody was diagnosed with a devastating brain tumor. 8 months after that, Brody died. So During Brody's treatment and after Brody's death, mindful practice became a necessity for me and my family. I don't think I could have survived without taking these moments to hit that pause button and calm my emotions, sit in my devastating grief for myself, for my family, and for my patients. So I bring this up just to show you that it's not just about the professional environment that we are dealing with the stress. We have some incredible stressful moments in our personal life that impact our work life as well. So some of the benefits specifically for healthcare providers: it reduces stress and anxiety, helps prevent burnout, increases emotional resilience and coping skills, improves attention and concentration, enhances empathy and active listening. Sometimes I think of the mind as like a jar of sand and water. Our stimulated thoughts and our experiences shake that, agitate that jar of water in our thoughts, and our concentration becomes murky. So this mindfulness, or these mindful moments, helps us quiet our minds, helps us be patient with our minds, and giving those moments helps that water and that sand settle so that our minds can be a little bit more clear and everything becomes a little bit more calm. Physical benefits: improved heart health by quieting the mind. You can reduce sleep problems and reduce chronic pain, or at least how to manage that chronic pain. Benefits in your relationships: strong relationships, increased compassion, reduce loneliness, improved communication, enhanced social connection. Within our teams, mindfulness can enhance collaboration and communication within the healthcare teams. It can foster a culture of respect, understanding, and support, improving overall team dynamics. And in this learning environment, in this high-stress environment, help us with openness to feedback and new learning, as well as just keeping up with the ever-evolving healthcare. Improved clinical outcomes. Mindfulness has been linked to better decision-making. Reduced stress leads to better diagnostic and treatment decision-making, and improves overall patient care. Again, here are some of these exercises: the mindful breathing, body scan, mindful observation, mindful eating and drinking, and walking meditation. So one of the simplest of a mindful moment, this is one of the most people practice when they get going with mindfulness, is just taking a moment to find your breath. Focus on inhaling deeply, pausing at the top, and then exhaling slowly out at your mouth. Helps calm the mind, reduces stress, enhances focus. There's various different types of breathing techniques. One, for instance, is a box breathing, where people inhale for 4 seconds, hold their breath for 4 seconds, exhale for 4 seconds, and then pause at the bottom for 4 seconds. Professional athletes, for instance, in the military, use this for relaxation and sleep. The body scan promotes relaxation through body awareness. You just basically mentally scan your body. You put your thoughts aside, and then you mentally just try to relax. This helps with body connection, stress release, and relaxation. Think about times where this could be useful. Brushing your teeth. How many times do we just put it on auto drive, brush our teeth, and we don't even remember we're doing it? There was a Vietnamese Buddhist, Thich Nhat Hanh. He talked about actually meditating while you do the dishes. Don't just do the dishes to get them done. Actually be present with the dishes. And then I think about all the surgeons in the surgical world. How about scrub time outside the OR at the sink, right? How many years have you been doing this? How many times have you scrubbed your hands? Do you remember scrubbing your hands once you go into the OR? So take that time to actually feel your hands, feel the brush, feel the water, feel the soap, and just have a body scan. That's a mindful moment. Mindful eating practice: observe, savor, chew, focus, and then give thanks for being able to enjoy that food at that moment. I know we're all rushing. I know that time is limited, but just take a moment to try to enjoy some food. Another one of my favorites is walking meditation. This combines movement and awareness, focus, the sensation of walking deliberately and slowly, focusing on each step, finding your rhythm of breath. This helps with body awareness. It's also a break from just kind of a seated meditation. This is one of my favorites. I actually do it in the stairwells here. So difficult patient, difficult time, difficult situation. I disappear to a stairwell. It's kind of quiet. I focus on each step, one foot in front of the other. I feel the ground underneath me. I feel myself pushing up those stairs, and I find my breath. So if you see me in the stairwells, feel free to join in. There's a lot of obstacles, and this can be challenging. Wandering thoughts, time constraints, judgment, are you doing it right? And then, but take that time and make it simple. Don't overcomplicate it. Be patient with yourself. If you do a mindful moment and you are working on a breathing exercise and your mind does wander, don't slap your wrist. Don't beat yourself up. Just recognize that thought. That'll be there for you when you're done with your mindful moment, and come back to that moment. These practices can be done anywhere, anytime, anyhow. There are a lot of apps out there that help us kind of harness these mindful moments. There's Headspace, there's Calm, there's Insight Timer. A lot of our smartwatches, smartphones can be set to remind us to take that moment. So just a quick little summarize. Mindfulness improves the well-being and fosters deeper connection with work-life balance. It's proven to have many benefits. Start simple, take a chance on it. There are benefits if you do practice just a little bit, 2-3 times a week. You will see the benefits. So that being said, I wanted to take you all through just a simple breathing exercise if you're willing. So as best you can, empty your hands, sit up straight in your chair, and you can close your eyes if you want to, you can leave them open. You can let your hands rest on your belly or in your lap. And what we'll do is we'll just take a couple moments just to breathe naturally. And you'll feel your shoulders rise. You'll feel your chest expand. You'll feel your belly expand. And then just focus on that breath going in through your nose, tickling the hairs in your nose, down your throat and into your lungs. Now, I recognize that I'm talking to a bunch of providers, scientists, so keep it simple. Let's take the science and the physiology out of this and just enjoy that cool air going through your nose, into your lungs, and then back out. And what you can do is you can look at what breathing techniques work best for you, but the simple one is you exhale everything all out of your lungs all at once, and then together we'll breathe in for 5 seconds. 1, 2, 3, 4, 5. Pause at the top, and then let the breath out. 5, 4, 3, 2, 1. Again, you can breathe in. 1, 2, 3, 4, 5, and pause. And exhale out of your mouth. 5, 4, 3, 2, 1. As you do this, keep breathing on your own. Feel that the chair holding you. Feel your buttocks sitting in that chair. Feel your feet on the ground. Feel the ground holding you. Feel the chair holding you. And thoughts are going to come into your head. Your mind's going to wander, and that's okay. Just recognize that there's those thoughts. I'll set them aside. They'll be there for when I'm done. And then don't beat yourself up. Don't slap your wrist. Then come back on into your breath. And just be gentle with yourself. And as you come to the end of a mindful moment, rather than flashing your eyes open, jumping up and running off to your next task, just gently open your eyes, take a moment to feel your feet, even tap your heels on the ground, rub your thumbs across your fingertips, and then just congratulate yourself. You just did a mindful moment, and that was what, 2 minutes? Doesn't seem like a lot. Doesn't seem like a lot. You can find a little place in your day, whether it's during a scrub time, in the halls, to have that mindful moment, and it does make a huge impact. So I'm going to leave you with this. So after my son Brody died, a group of his friends got together and they raised a bunch of money and they got permission from DPS, Denver Public Schools, to place a bench in front of McAuliffe Middle School. And they asked us for a favorite phrase from Brody, something he might have said or something he liked to read. And one of his favorite books was The Boy, the Mole, the Fox, and the Horse by Charlie Mackesy. So we gave them one of Brody's favorite phrases from this book, and they put it on the bench in front of the school. And the plaque says, "What's the bravest thing you've ever said?" asked the boy. "Help," said the horse. So Brody's principle tells all incoming classes of Brody's bench and that it's a safe place. And so I hope you all can find your bench. And when you do, it's okay to ask for help. Thank you very much.
We have time for questions, comments. Dr. Cleveland.
Okay, it's not a microphone. Thank you. That was fantastic. My experience with this is a lot. I don't want to visualize, obviously, losing a child, which I can't imagine. But 3 weeks ago, I had the good fortune to visit my son, who's a professional golfer in Florida, and went to the academy. And by what I mean by that, he's kind of playing single A ball there, but he's part of a development team, and they spent about an hour every day doing this. And for anybody in the audience, and obviously I won't make too many golf analogies with my passion for the game, but obviously Wyndham Clark, who is from Colorado, struggled for the first 10 years of his PGA Tour experience before he won anything. And when you read into his biography, what it was that brought him to the elite level when he won a US Open was to practice this in these moments on the golf course when, similar to the OR, you're hit with something that's very adverse, and just how to be present in the moment and reset things. So this is an incredibly powerful technique. And as you alluded to, professional sports, the military, other people use it. I think that absolutely it's a great technique. So thanks for introducing this morning.
Yeah, thank you.
The other thing that I personally have tried to do is, I try to exercise every day. And it's typically something very boring, like, getting on a spinner bike or an elliptical or whatever. And I actually use that time to do exactly what you're describing. And, we're all used to multitasking a little bit, but I challenge everyone to find something that's relatively routine that they do every day, whether it's scrubbing at the sink or, doing whatever. But exercise, I think, is a great place to take at least a portion of it and practice this mindfulness.
Yeah, I mean, they've talked about long distance runners, athletes, that actually that is a moment of meditation, right? You don't have your computer, you don't have your desk, you don't have your responsibilities. You just hit the road and you're out running, treadmill, exercising, gym, whatever it might be. You're focused on your body, you're focused on the here and now. So that, yes, absolutely.
Good. Well, Jeff, thank you so much.
Yeah,
that was
thank
wonderful.
You. Yeah, thank you.
You're welcome.
Right. Our next speaker, Dr. Paul Maroni, will be delivering a talk on longevity in practice, why it matters, and how to help yourself and others. So Paul has been really a leader in our urologic oncology and urology division. He did his undergraduate training at University of Virginia, medical school at University of Illinois in Chicago, and then came to CU to do general surgery training as well as urology residency. He completed a year of urologic oncology fellowship at the University of Indiana, and then came here and has been on faculty since 2007. He's held many, many leadership positions within the division, within the hospital, and just two examples are medical director of urologic oncology clinic and director of robotic surgery at UCH. If you read through his awards section on his CV, he's won numerous faculty teaching awards and other service awards. And these include, not only at CU, but in the region and around the country. He's been principal investigator for many trials, many clinical trials, and I counted at least 24. He runs many education courses, especially for the Rocky Mountain Urologic Society, where he's been past president. He's extremely well published. And lastly, he's really known as an excellent technical surgeon and is really one of the people you want to go to should you have prostate cancer. And with that, I'm going to turn it over to you. Thank you.
Thanks, Rich. Yeah, it's nice to hear that you're exercising a lot. So thanks for offering a nice segue into what I'm going to talk about. There are literally thousands of books written on this subject, so I want to get into this pretty quickly. So imagine you're a business owner in love with making widgets and intend to run the widget making business for a long time. You need to purchase a widget making machine, and here are your options. You can run through that, and I won't make you do the math on this, but if your goal really is making a lot of widgets for a long time, you would, of course, pick choice number 4. Now, I'm going to change the context a little. In the next 10 years, we are going to be 10 to 20,000 surgeons short of what is necessary to handle the medical needs of our country. Now, projections are sometimes wrong, but even if they're off by a factor of 10, which of us even wants to do a little bit more work? This is an all hands on deck situation. This is not an easy problem to solve. There's not a magic surgeon tree we can just walk over and pluck new surgeons off of. Training surgeons is a big investment and takes a long time. Every surgeon that leaves the workforce because of burnout or illness makes the job a little harder for the rest of us, which is a positive feedback loop. And that's what I'd like to prevent. We need to invest in the resilience and health of the surgical community. So now if you substitute surgeons for widgets, this carries a different weight. First of all, I could spend 10 minutes on this slide, and I won't, but I do want to talk about a few things. Please don't feel commoditized. And this is massively oversimplified, but I'm trying to make a point, and it's this. If we want a healthy surgical workforce, we are better off if we have people working at sustainable rates for a long time. Here's the crux of the issue. And I apologize. I'm going to use a lot of metaphors today. One of them is that the practice of medicine is like a battlefield. And I credit the Fist Pumps book, which I will reference in a minute. There are many similarities. What we do is hard, unpredictable, and high stakes. Most times, I hope we feel triumphant. Other times, we might feel totally defeated. All of us have good days and bad days, but there does seem to be a difference between individuals in being able to handle certain battles. What I mean is, despite a similar stress, some providers burn out while others handle it just fine or even thrive. Some win the war and some don't. Losing the war can mean many things, but none of them are good. Substance abuse, depression, medical errors, leaving surgery altogether. And the next point I want to make is crystal clear. These are not inherent character traits, but rather something that can be learned. To carry this metaphor further, the people that are winning the war seem to just have better equipment, better armor. What is this so-called armor? The term I like is resilience. And just like armor, we can use it or not. I'd recommend using it. More importantly, if we spend the time, we can make it stronger. And that's what I hope to help you do today. Now, I can hear some of you saying, why does medicine have to be like a battlefield? Why can't it be a field of flowers or something? And I don't disagree that the condition under which we work could be improved, but I don't think waiting for that to happen is a good strategy. Also, building our armor will help us not only at work, but in other aspects of our lives. Also, I hope none, but maybe a few of you might be saying, I'm not in this for public health. What's in this for me? Well, the tips I'm talking about today will also probably help you live a little longer. Here are my objectives. I've already summarized why longevity in practice is important for U.S. healthcare. I'm going to help you identify ways to improve resilience in practice and longevity in general. And I want you to teach you how to utilize what we call mountaintop decisions. I have some disclosures, none of which I think are relevant to this talk, but I most humbly say I don't know everything. Again, there's thousands of books written on these subjects. I did use a lot of images by AI, so thank goodness I don't have to get copyright. So what's a mountaintop decision? This is a symbol of clarity. You can go up there and you can look over the valleys and you can see where you've been. These are intentional decisions. You have some commitment here. These are not situationally dependent. So these don't depend on this. You actually create borders and boundaries and you sort of respect those things. And these are things that you can revisit. So the idea here is you're not always at the mountaintop, but often during our day, we have a choice between going down into the valley and going up to the mountaintop. And if you don't know where your mountaintop is, it's hard to kind of make that decision about where you want to go. Again, getting back to some mindfulness about the decisions that we're making. Now, I want to talk about characteristics of resilient people. And if you're going to take a picture of one slide, I'd probably take a picture of this one. And when you look at people that are Navy SEALs or childhood abuse survivors, you actually find certain characteristics in these people. And I think these are all things that can be learned. They tend to have an active coping style that's either problem focused. So what that means is that you actually encounter some sort of issue and you might have a solution to solve it. But oftentimes we have a problem and we can't solve it. So then you need to be emotion focused. You need to figure out how you can cope with the fact that you don't actually have a solution for that problem. As opposed to what's a passive coping style, which tends to be denial, this is not really happening, avoidance, I don't want to deal with it, substance abuse or resignation, oh, this is just the way it's going to be. Now, also characteristics of resilient people tend to engage in physical exercise, which releases endorphins. This is biochemistry. Serotonin, brain-derived neurotrophic factor, which increases brain plasticity, which helps you with adaptation to stressful situations. So exercise is good. They tend to have a positive outlook. It activates reward pathways, ends up drawing social support. Who wants to be around negative people? Not many people. We tend to stay away from those people. We want to be around positive people. You want to draw people in, and that tends to promote more active coping. They also tend to have a moral compass. They feel purpose in what they do. And that's really easy, I think, in finding this in the work that we do. And they also have cognitive flexibility. They can reappraise events, reframing neutrality. I could spend the whole lecture talking about neutrality and why I think that's important, that the goods aren't as good as we think they are and the bads aren't as bad as we think they are. I'm not going to do that. In all of this, again, is this idea of agency. We can make decisions around what we do. These characteristics can all be learned. We can become capable. We become capable through practice, but we are still subject to our biology. And just because we're capable doesn't mean that we're actually going to use these skills. We might not feel good. We haven't slept. We're hungry. There's times when I know that I am weak and I'm going to make worse decisions. So how do we keep our body from sabotaging our resilience? And this is what I call building our armor. And I'm going to focus on these three areas today. So sleep. Now, sleep and longevity, this is perhaps the most important thing that you can do. Sleep maintains, repairs, improves almost every bodily function. If you're fatigued, creates more medical errors. There's lower energy. Negativity, you're a Eeyore, you tend to harm your relationships because you don't feel good. So how can we schedule 7 to 8 hours of consistent sleep opportunities? And why do I say 7 or 8 hours? Well, it turns out that this is a U-shaped curve. If you're really not spending that much time in bed, you're probably not going to live as long. Whereas if you're spending too much time in bed, there's lots of possible confounding here. But this is perhaps the single most important tool for maintaining our health. Why do our bodies spend a third of our time totally paralyzed and vulnerable to the outside environment? It must be important if biology makes us do this thing. And the National Sleep Foundation actually recommends that adults get 7 to 9 hours nightly. It's 7 to 8 hours if you're a little bit older, maybe a little longer if you're younger. And I can hear your objection. You say, well, I got stuff to do. I got to work on this project. But I can say there is nothing more critical than setting a morning wake time and then measuring back 7 to 8 hours. And that's your bedtime. And when you get to your bedtime, you go to bed. Now, also, I want you to focus on not only the time we spent in bed, but sleep quality. This is also related to some, if you have poor sleep quality, related to some fairly bad things, poor occupational well-being. Again, lots of confounding, but there's some other things out there as well. But I would encourage you, in order to improve your sleep quality, to build and maintain a sleep routine. And there are lots of ways that you can improve your sleep. This is called sleep hygiene. Consistent times, as I mentioned, make sure your bedroom's cool, make sure it's dark. Try to avoid large meals within 3 hours of bedtime, might also help with weight loss. Avoid alcohol, no screens, and avoid stimulation. Now, I am also somebody that has suffered tremendously from insomnia for over a decade. And so I know a lot about this. If you want to talk about it offline, I'm happy to talk about it, but I'll run through some of these things here. So first of all, consider a medical condition. It could be something like sleep apnea. You want to get that looked at. But different ways that I deal with this is, you assess your sleepiness. How sleepy am I? If I'm not really sleepy, well, I don't try to go to bed. I know I'm just going to lay in bed. Other things you can do to encourage sleepiness. How do I manage ruminations? If I wake up in the middle of the night and what do I do? I'm thinking about one thing over and over again. It's hard to get out of my mind. Well, I have a strategy for how to deal with that. I try to also tell myself, and this is actually true, is that even when I don't have a really good night of sleep, like last night, I'm nervous about this talk, I feel pretty good today. Okay, so if you're feeling pretty good, you're probably all right. And then cognitive behavior therapy for insomnia is very, time in bed restriction. This is a very interesting thing. I've done it, it works, but have a plan. What do you do about medications? I've used medications before for sleep, but I've found ways that I use them now very rarely. And so, and then I also would say, as an aside, try to be aware of sleep tracking. They've got these things on your watches now that measure this stuff. And I actually think they're counterproductive. You tend to get a little bit of anxiety around this. Although I do think that if you do have this problem, that a sleep diary can be very helpful. And I will still do that from time to time, especially if I'm having problems. So I have a plan. I'm not going to elaborate on all this, but just understand that it's pretty complicated. What do I do in different situations? And this is how I manage being able to sleep better. Now, I really hate talking about this subject. People almost get, religious about this, and it's kind of hard, but it is also very, very important in what we're talking about. And if you look at, if you talk to a trainer who's trying to, improve your fitness, they'll say, 80% of this, I don't know if I agree with that, but 80% of this starts in the kitchen. And I'm going to be really elemental here, and that is something called energy balance. This is your calories consumed minus your basic metabolic rate plus your calories burned. Now, you have some influence over your calories consumed and calories burned. Maybe you can slightly alter your basal metabolic rate over time, but that's kind of hard. But here's the truth. Our food system is not designed for your health. With capitalism and a focus on profit comes low-cost ingredients that are generally not healthy, that's focused on taste, portability, acute safety, not chronic safety, keep in mind. Acute safety, you're not going to get some acute illness from this, and also shelf life. Now, I'm not impugning food scientists here. It's an important thing, and a lot of people make a good living on this, but they know what you want. And it's the 3 V's, variety, velocity, and volume. They're actually designing the food so that you will eat it faster, okay, and overconsume it, which again, getting back to capitalism and profit. And what happens with chronic positive energy balance is chronic weight gain, which is obesity, and a whole list of diseases that you probably don't want. Now, I don't want to make this sound super simple. Some of the most disciplined people I know have problems with their weight. And this is complicated psychology and biochemistry. And I would encourage you to read Rick Johnson, who's a faculty in the university or in the Department of Nephrology or Department of Medicine Nephrology here. Nature Wants Us to Be Fat. The first half of that book is beautiful and you'll learn a lot of things. But when people are losing weight, they don't feel very good. Fatigue, they get hormonal changes, there's hunger and dehydration. They might feel some anxiety and shame because of all this. When you see somebody that's overweight working out in the gym, that person, it's probably a lot harder for them. They're probably experiencing more physical pain in the gym than the most fit person that you see in there. They have more energy demand, less efficient mitochondria, less effective lactate clearance. It's building up in their body. Joint discomfort, muscle soreness. I mean, we should be giving these people fist bumps in the gym for being in there. These people are suffering more than almost everybody else. So I don't want this to sound like, it's a simple problem of discipline. And I would encourage people that if they are struggling with weight, to just take it really slow and show yourself some compassion. Now, getting back to nutrition and longevity, we have a couple of choices. We can eat highly palatable, easy to overconsume foods, which results in the metabolic disease I explained, or we can restrict something. And I do a little bit of all this. They may say, Maroni, you don't have a weight problem. Well, I do all of these things. Caloric restriction, dietary restriction, time restriction. Basically, caloric restriction, you're just eating less. Dietary restriction, you're deciding you're not going to eat certain things. You could be a vegetarian, you don't have to be that, but you might say, well, I'm not going to eat this particular thing. Time restriction, where you're eating in a narrower period of the day. So how can we stay healthy and manage our hunger? And I'd say we need to use our biochemistry to our advantage. Again, I want you to feel good. I want you to be able to make good decisions. This whole idea that we're building our armor, it's really hard to do if you don't feel good. And the reality is that fat, fiber, and protein will stay in our stomach and gut longer. They attenuate insulin release. Because insulin, you get a big high, or sugar crashes. Now we don't feel very good, and we need to go eat something else. I do like this book. My thoughts on this are evolving a little bit, but I do take a protein-first approach to my meals. And to aim for 1 gram per pound of body weight per day. That would be a lot, I would say, on a practical level. That's actually pretty hard to do, but this is a good goal. Where you'll probably find is probably 0.7 to 0.9 grams per pound of protein a day. Now, when we talk about protein, we're really talking about amino acids, and I almost rather we would call them that, because 9 of them are essential. We need to get these into our body every day. Now, some are conditionally essential, meaning that when we're sick or ill or not feeling good, we actually need to have them in our diet because our body can't make enough of them. Now, this I consider to be a superfood. They can be converted into really anything. Glucose can be turned into fat. They can really be turned into anything, but they're essential for tissue repair and growth, muscle maintenance. Your muscle is basically your protein reservoir in your body. If you're not taking enough protein in, you're going to start wasting muscle. That is just the way it works. Enzymes and hormones, they are important for our immune function, and they also help with satiety and have a higher thermic effect, which means that they actually cause our body to burn a little hotter, which burns more energy. Our nutrient processing does deteriorate with age, so I'm expecting that probably as I age more, I'm already 51, but I'm probably going to need to be aiming more for that 1 gram per pound of body weight per day. Now, I do consider fiber to be second. So for nutrition, similar to managing sleep, I do think it's important to have a plan. And I'll kind of point out a couple of things. So it's almost embarrassing to go to a hospital cafeteria and struggle to find a healthy meal. But here's what I do when I go over there. So I walk in, I go to the salad bar, I put a bunch of leafy greens in the bottom of a bowl, and then I turn 180 degrees and I walk over to the protein area, that thing in the middle with the meats, and I heap a bunch of meat on it, and then maybe I'll put some cottage cheese and some garbanzo beans around it. But I'm getting my protein and my fiber, and I call that my protein pie. Now, the other way that I like to think about weight is, I don't care if you weigh 400 pounds, but if you can dead hang and wall sit for 2 minutes, you're fine. So to actually balance our weight with our strength is probably more important than looking at our weight overall. And a dead hang or a wall sit are a good way, and there's norms that you can look up on the internet to say, okay, am I healthy? Am I okay? Like if you can't wall sit or dead hang for 30 seconds, you probably need to get a little bit stronger. And getting into that. So fitness. Now, when you look at longevity in our muscles, there's actually, unlike, with nutrition, we can kind of talk about, okay, yeah, this is sort of nutrition is sort of your gateway to disease. Whereas fitness is sort of your gateway to wellness, okay? So if you look at what's important for longevity, there's different hazard ratios for muscle mass, muscle strength, and muscle power. Now, I don't know if you noticed, I actually walked from over there and I leapt up onto the stage, okay? Which seems a little awkward for a guy in a suit. But that takes muscle power to actually leap, okay? Now, I do think that for some of us, because these things deteriorate with age, in fact, power is one of the first things that deteriorate. And I think some of it is not because we're losing it, it's because we're not using it anymore. If I had put a 7-year-old over there and I said, come up to the stage, we would expect him to leap onto the stage. We wouldn't expect him to walk over here and kind of climb up the steps calmly and walk up here. He would be leaping all over the place. So if you look at kids and how they're bouncing around, I want you to try to bring a little bit more bounce like that into your life. But if you look at the things that are most strongly associated with longevity, it's muscle power, okay? So I might jump off the stage when I'm getting off, okay? So these things are pretty important. So if you're gonna focus on anything, focus on developing strength and power. What is power compared to strength? Power is strength over time. So how fast are you actually moving that weight? Now I'm going to blend in cardiorespiratory fitness, and the relationships with longevity are even stronger. Okay, so when you're trying to think about how do I compose my week and what am I going to do? Okay, well, you want to be focusing on probably these bottom 3 things. Like I do think protein is important for muscle mass, but really, if you're looking at longevity, focusing on the strength, which is related to the power, but also your cardiorespiratory fitness. And I did create these charts. Courtney, you can share these slides with people afterwards, but these next 2 slides sort of highlight all the sort of differences between things. And I did put yoga and Pilates on there because I think that's an important thing. But if you look at things like the time commitment, Zone 2 training, which is this idea that where you're kind of trying to improve your mitochondria with through cardiorespiratory, it takes a lot of time, and so that's pretty hard. But if you want to get more time dense things, we don't have a lot of time. Maybe a HIIT class would be better. If you're wanting to work on strength training, there's different ways to do that too. But you're not really going to build strength by doing cycling all the time. So Rich, you got to get in you go to the gym though. Yeah, okay. So so I do think you need to blend some lifting resistance training with some cardiorespiratory fitness. And this is just another chart showing the same thing. And if you kind of look at the bottom, like the long-term sustainability, yeah, it's very sustainable to do this. It just takes a long time for the Zone 2 training, but the same thing for yoga or Pilates. But with strength training, you tear a muscle or something like that, that could set you back a little bit. So there can be some problems there. So here's my takeaway. An effective training program can blend all 4 approaches. Use Zone 2 for base building recovery, sprinkle in some HIIT for, if you don't have a lot of time. Strength training, prioritize strength training for function and resilience, and then integrate some yoga and Pilates for this. So I'm going to try to move through this one pretty quickly. So different ways to get fitness. You do need to schedule this. I'm going to say some things that are unique to here. We have this beautiful staircase that goes 15 floors right by elevator E. Okay. And you can just walk, that could be your cardiorespiratory fitness for the day. Do that once, you're probably good for the day. We also, if you don't know, have a small gym that is free in the basement of AIP2. So if you go down those same stairs, you go down to the very bottom level, you go out the door in the basement, you make a right turn and you curl around the corner to your left. There's a door that says employee fitness. You use your badge, you go in. It's got some weights and some exercise equipment. So try to get some of those. And then I do, sometimes I'll do what's isometrics in meetings. If this is something, yeah, I think we got the time. Okay, put both of your feet on the ground in front of you. Now, without raising from your chair, I want you to try to drive those feet into the ground 1 inch and feel your quads tense. Okay, could you do that in a meeting? Hold that for 30 seconds, maybe 60. Okay. All right, you're actually burning ATP right now. Your muscles are getting stronger. Isometrics is a good exercise. Now, the other way to do this, so that's your quads, okay, so relax for a second. Now I want you to plant your heels pretty firmly. Now try to drag them back towards your buttocks. Now this is the hamstring part of the exercise. So do that for 30 seconds. So if you're in a meeting, you might get that, some people might look at you and why is he looking kind of constipated right now? But okay. But this is one way there you can actually, maybe you had a day where you didn't get any exercise, you could actually do a little bit of isometrics in the meeting. My tip here is to get a trainer, and I've used trainers in some capacity for many years. Especially if you're just starting, you're intimidated, injured, interested, or in a rut. I call them the 5 eyes. I've done in-person. I find it kind of expensive, but if you want to, it's great. If you like interacting with somebody, a little cheaper way to do it would be to do it in a class where you have somebody that's kind of instructing everybody what to do. I personally use a virtual training app called Trainwell. It's about $50 a month. I love it. I have a virtual trainer. He lives in Rhode Island. I text him all the time. I say, hey, I got a shoulder injury. I got this going on. I got that going on. I've got a snowboarding trip in a month, and he makes my workout program for me. All right. It's great. All right. But I don't need to work out with it. Some people get energized by working out with other people. That's not me. But there are other app-based workouts like Nike Training Club. There's the 7-minute workout, which is a good one. I have that on my phone. I don't get a workout in. I know this is something I can do in my office. It's all body weight. But there's other ones that are out there as well. Okay, to summarize, this is an all hands on deck moment. We need to have a team marathon mentality around this. I do think we need to think about this as a community, that we need to be helping each other too. Like, hey, let's go walk the stairs together. I know Gene Moore does this when he was at Denver Health. Build your armor. First thing, you gotta spend the time in bed. All right, that is almost one of the most important things you can do for your long-term health. And embrace sleep hygiene. Does your strength match your weight? Okay, you can build this slowly over time. And then where's your mountaintop, and try to figure out how to go there. And hopefully, as a surgical community, we can take care of all the things that we need to take care of. Now, I do want to spend a moment talking about this guy, because on the subject of longevity, I'd like to end with this. So fewer and fewer of you recognize this man, but he's someone I deeply admire, and he was always good to me. Ben Eisman was a surgeon in Denver and a part of this residency program for over half a century. My experience with him was towards the end of his life, when he was still attending grand rounds and in the VA office a few hours here and there in his 80s and 90s. I don't think his longevity in practice was luck. I know he found deep purpose in his work, but also he was an incredibly fit man. He was the founder of the 10th Mountain Division Association. We're talking about mountaintops. This guy was literally on mountaintops making trails. He provided medical support on Everest and K2 when he was in his later 60s. He was chopping wood into his 90s, which reminds me of a Buddhist quote. Before enlightenment, chop wood and carry water. After enlightenment, chop wood and carry water. I think any of us would envy a eulogy like Dr. Eisman's for what he contributed to our department, his trainees, and the lives of his patients. Thank you, and I hope you have a great week. Yeah, hop up.
That was great. Any questions or comments? Maybe I'll start off. So, you focused on strength, power, and the other key thing that I find I'm losing, and we're all losing, is balance, right? And if you look at a lot of the societies that live the longest, they actually routinely practice strength and power training, but also balance activities, and I think that's really important.
Yeah, and the way that you can integrate this in is with one leg exercises. So, I'm still trying to do heavier, 2-leg exercises or 2-arm exercises. But as I age, more one leg exercise, like a 1-leg RDL. I think if I was going to pick one exercise that I had to do for the rest of my life to try to preserve strength, I could only do one, probably a single-leg RDL, which if you have a weight, you could put it in either hand, really. It's actually more challenging in one versus the other, but you basically just go like this. And you're trying to, again, build the fast twitch muscles in your leg to be able to balance that weight.
Yes, Mitch.
Paul, really nice talk and really important. Jeff, you as well. Can you comment on how this is relevant to our patients, right? I mean, it seems to me that this takes care of ourselves, but we as elite performers, this really helps us be better surgical performers and take better patient care and avoid complications and do better in the OR. And the activities that we do, you would never see, per Dr. Cleveland's comment, on a sports team, right? You wouldn't keep your star player up all night the night before the big game. You wouldn't have them eat poorly. You wouldn't do all the things that we do on a regular basis, which you're providing countermeasures for. So how do we take this to get a mindset where this is really not just about taking care of ourselves, but really being better surgeons and better practitioners in our daily lives?
I'm so glad you asked that question. Did I plant you in there? Okay, so I got a lot of comments about this. One, I do exercises to prevent pain in the operating room. That's the simplest thing. Two is this, again, like I mentioned, the whole talk is I'm trying to feel good so I can make better decisions through my day, make those mountaintop decisions. Three is I want to walk the walk. So when my 300-pound patient walks in with a Mountain Dew, I can lecture him a little bit and say, yeah, you need to, that's poison. You need to put that away. Okay. And I'm not, and I can do it and not just like, I spend a lot of time talking to patients about nutrition fitness if they ask, or sometimes even if they don't ask, I'm like, look, you've got low-grade prostate cancer. This is not going to kill you. But the fact that you're 30 pounds overweight, if you want to focus on a problem, I know cancer is scary, but it's the weight that's going to be your medical issue. Let's focus on a front burner issue. And here's how I can help you deal with it.
I hope Andy Meacham doesn't hear you talking about Mountain Dew like that. All right. Everyone have a great week and thank you. Thank you.